Good evening. Welcome to another edition of DeBakey CV Live Innovation on the Loose, streaming live from Houston Methodist Hospital here in the Texas Medical Center. I am Dr. Stuart Corr, Director of Innovation Engineering for the DeBakey Heart and Vascular Center. Now tonight we will be taking a trip into extended reality and learning about the Varjo and mixed reality workflows in healthcare. Now to that end, I'm delighted to have Geoffrey Bund on the show. Jeff is Head of Business Development for Varjo's North American operations, and we've been working together for some time now on how the Houston Methodist Center for Extended Reality and Varjo can collaborate together. Before we proceed, I'd like to invite the audience into our discussions. So please submit your questions via web at pollev.com using DeBakey as the username, or text DeBakey to 37607 alongside your question. You can also add your question into the live YouTube stream. Now, for those of you who can remember, we officially launched a new initiative back in September 2021 called the Houston Methodist Institute for Robotics, Imaging and Navigation. And if we have a look at my slides here, you'll be able to see a little logo in the back. There we go. Now, the launch was in the form of the first ever annual symposium for the Institute, with a theme of exploring extended reality and robotics. Now, at this virtual event hosted on YouTube and Hopin, we were delighted to have a full host of participants from a variety of industrial and academic collaborators. And keeping up the momentum, we then went on to form the official YouTube channel and content provider for the Institute, which we are calling Robotic Health. Now, our Robotic Health channel is the place to go to learn about all the Houston Methodist activities in the areas of robotics, imaging and navigation, and the roles they play throughout the entire patient journey. And you can go there by typing our domain name, www.robotichealth.org, and I believe there's a special prize for the 100th subscriber. So please subscribe. Now, before we go on to our guest, I am going to play a very, very cool video. This is the actual intro video by Varjo, and it's going to give you an overview of what Varjo is, what they do, and what we're going to learn about tonight.
Our dream is to move beyond a simulated experience to a real experience, where we remove any negative training entirely and recreate the exact feeling and conditions of the most mission-critical scenarios.
For many years, our industry has sort of been reluctant to dive deep into the XR solutions. The challenge has been to accurately replicate high-pressure environments that are emotionally engaging for the users.
High fidelity is critical for effective mixed reality training for pilots. With the Varjo XR3, the realism in the field of view is further increased and prepared, which removes negative training when recreating conditions at the most mission-critical scenarios.
Varjo's new full-frame bionic display, with its wide and natural field of view and its mind-opening human eye resolution, is the perfect key for our extensive design work in XR. The advanced step sensing and LiDAR should give us the possibility to merge the real and the virtual, enabling a fully immersive experience and natural body and object occlusion.
Varjo has pushed the boundaries of high-resolution mixed reality. By working with Varjo, Unity continues to power the next level of photorealism and immersion for industrial design, simulation, training, and more.
Using their own hands and medical equipment takes our healthcare providers to a more immersive emotional state, achieving a higher level of focus that could ultimately save lives.
Unreal Engine, coupled with Varjo headsets, has allowed users to power some of the most demanding use cases of immersive technology. The new XR3 and VR3 allows creators to explore the next frontier of immersion using the unprecedented level of visual performance.
Okay, now that we've set the tone, I'd like to introduce the audience to Geoffrey Bund. Jeff, welcome to the show.
Hi, Stuart. Thanks for having me. It's a pleasure to be here.
So maybe you can start just by kind of highlighting, who you are, what you're doing, your role within Varjo.
Sure, yeah. I've been at Varjo now for about 4 years, which in the VR startup world is ancient history. I was the first US employee here and started working out of Los Angeles and moved our headquarters out here to DC. I'm in Arlington, Virginia right now, about 2.5 years ago. And I've had the distinct pleasure of really pushing us into new markets, whatever that is. So at first it was a lot of flight simulation. We worked a lot with US DoD and other entities. And now we moved pretty rapidly into design and other use cases like that, like visualization and modeling on the high end. And I've had, really the distinct pleasure to start working a little bit more in medical in the past year or so, or even before then, I suppose. But the past year or so, we've had a focus into like what's new, what's fresh, and what really adds value to people who are wanting to embrace immersive technology in their jobs. So that's what I've been up to, and I could go into more detail on any one of those things if you like.
Yeah, I think that'd be great. Now, I know you've got some slides here, that we're going to start learning a little bit more about the specifications of the Varjo from an engineering standpoint. So maybe we can start with that and then see some use cases and applications in the healthcare space. I think that'll be fantastic.
Sure, yeah. Here we go. Can you see my screen?
Yeah, looks good.
Great, yeah. Well, just to give a little bit of background, because I'm sure this audience, a lot of them might not be familiar with exactly what Varjo is, and the video did a great job. But basically, what we are is a company that's focused on what I like to call like uncompromising virtual reality and mixed reality. So our headsets and our hardware fit in a cost envelope where we haven't had to compromise on a lot of the visual quality and performance that consumer headsets that are designed to really be deployed in the millions are. So what that means is that we have a display that uses 2 displays per eye that allows us to deliver human eye resolution to the viewer. It means we do about 60 pixels per degree, which is about 3 times higher than the next highest. But what that means is that in practical application for training pilots, for instance, the pilots can see the gauges and dials in their instrument clusters without having to lean forward or strain, or without the developer having to build some kind of artificial magnification in the application. We also have a pretty novel approach to mixed reality. We use cameras instead of a lens, like a HoloLens. So what that means is that when you're using a Varjo headset like an XR3, you're sensing the world around you through a camera stack, not through like a passive lensing system. That allows us to give a lot of control over the image. Like with a camera pass-through system, we can do things like we can add dark to an image, which is not possible in a lens system. And we found that that's actually quite relevant, especially in high lit areas like operating rooms or outdoor areas, things like that. And then the other thing Varjo does is we have hand tracking and depth sensing. So our headsets have a lot of different things built into it that allow the user to sense things around them. We have a LiDAR stack, we have a hand tracker. And then one thing that I've been kind of pushing internally that I feel really passionate about, but we're just seeing the early days of, is that all our headsets have an integrated eye tracker that's the best in its class. So it can do sub-degree accuracy, which means it can sense where you're looking at an acuity that's less than your thumbnail width at arm's length.
Wow.
So we can pull really accurate measurements, and then we also have a 200 hertz refresh rate on it. So what we're seeing And we're just scratching the surface of it right now, but what we're seeing is companies that are able to build these really wonderful advanced applications, doing things like analyzing saccadic behavior, and the movements of the eye to do things like do some early screening for concussion and traumatic brain injury, health, fatigue, early screening for degenerative muscle disorders and things like that. And it's super early days, but it's something that I've been really passionate about the past year and a half, 2 years or so, to try to get that going more. This is just a picture of our device. You can see here the way it looks. You can see all the sensing that's packed into it. And I have one in office that we might show later. Just briefly, just to give a sense, I don't think these prices are valid anymore, but this is roughly the price. So we're not designed to be like a $200 or $400 headset. We're really designed to go in and cutting edge applications with people who have high risk, high paid, or high value jobs where the consequences matter when they're training, to a very high degree. We just launched this other headset, which is slightly more affordable, and we're seeing a lot of uptake with this. It takes advantage of a lot of our imaging technology, but we stripped it down to be more affordable and be deployed. Maybe more importantly, it's able to be deployed on a laptop, so you don't need a super high-powered GPU. So we're seeing this a lot more in classrooms, in lower-end flight simulators and things like that. It's called the Era. Yeah, and I want to make sure that I'm always presenting to, especially a community like this, with a lot of humility. I'm a total neophyte to the medical space. I've only really been doing this for Varjo for a couple of years, and I'm really excited about it. But I know that I don't know a lot, and I'm really excited to see what's possible with our technology in the hands of end users like you, Stuart, and some of the other people we're working with. So what I'm going to do is just really briefly, I think, go over some of the more exciting things that we've been working on at Varjo, and what that looks like is really software partnerships. So I have the distinct pleasure of finding new companies that are often young and small, and finding the ones that I think can really add a lot of value to a certain industry or a space. And I love how I get to really play in like the niche spaces. And so we've been doing some interesting things in molecular visualization, surgical training, first responder training. I think we have some really interesting work going on in 3D visualization and medical imaging. And then one thing that's probably our most mature offering and partnership is we've been working with a company called Touch of Life Technologies, who has a dissector lab anatomy trainer that's just really visually really wonderful. And we're seeing a lot of adoption of that in different schools and at the VA, among other places. So I'll hit into it a little bit with just some video. This is a company called Nano that has a molecular visualization software. This room might look familiar. This is where I do all my screen capturing. But what Nano really does is that they've built a visualization platform that relies upon the industry standard algorithms that govern the interaction between different molecules and other, I think, particles and proteins. And they've programmed those algorithms to be in the visualization platform with a high degree of accuracy, so that people who are designing drugs, treatments, vaccines, those types of things can collaborate in a high visual acuity environment. These guys are probably one of our newest partners, so we're still seeing where this can go, but it's pretty exciting. And there's also a lot of interest in using this as a collaboration platform. So, people are starting to talk about the metaverse quite a bit. It's one of the buzziest of buzzwords right now, but the thing that I think is really cool is companies like Nano for the past few years have been building this kind of like metaverse solution for this. Like, pharmaceutical professionals and other people can go and be in this persistent and useful space while they build their products. And I think that's really wonderful.
Hey Jeff, we're actually going to switch slides here. I do have a copy of your slides, and I want to make sure we're getting the best quality.
Got it. I'll stop sharing.
Yeah, there we go. I think that's coming through a lot clearer there. Now, we've actually worked with NanoMe before. Professor John Cook here had a cardiovascular science conference recently, and we took this out to kind of show him, and we're trying to, again, the Center for Extended Reality are trying to see how we can integrate things like this into research and development tools. And I've spent a good few hours in this myself. I mean, it's absolutely incredible. Okay, so how about you just tell me when you want the slide to move? Should we go?
I actually
onto
can't
Orama?
see the slides, so I will do my best to reference them on my desktop here.
Okay.
But yeah, we can advance. The next video we have, I can talk a little bit over it. I don't believe it has sound.
So it's
is
Orama.
A company that we worked with called Orama VR, that's doing surgical training. We've seen a lot of surgical training companies go with different headsets because of the ease of deployment, but Orama decided that high visual quality was really the most important thing to them, especially for certain applications, and they had some customers that were requesting it. So we built an integration, and what you can see in this video is a knee replacement surgery that's going through it. And I think a thing that's possible with our headset that's not with any others is to really be able to see the background of the scene with a high amount of acuity. So if you can see the X-ray view and the different other feedback and instruments that is behind the patient, that's something that's possible in our headset that it's very unlikely that someone would be able to read that with any amount of accuracy at that distance in a different headset. So, and again, back to, if we want to advance the slide to the VR collaborative image.
It's playing.
Great. And then, this is another thing where we've seen companies, basically have been working in this kind of metaverse space for a long time now. I mean, Orama's had the functionality of allowing doctors to work with each other in these training scenarios, for quite some time. And I think it's really powerful when we see the ability to be able to bring in like an expert remotely and to do some consultation or to train newcomers to the space. The power of the collaboration is really strong. So yeah, could we advance the slide?
Yeah, and I think the next slide is the Loma Linda University simulation. So just so you know, Jeff, I think one of our tech team are going to send you the link to our YouTube channel via Zoom, so you can maybe bring that up on your screen. Just
I have it now.
Okay, superb. And don't forget to subscribe, Jeff. Right, so I thought this Loma Linda University simulation was absolutely mind-blowing. So you want to talk to us about that?
Yeah, absolutely. So we've actually done a few things with them, and the video that we'll show here is of a mixed reality trainer they put together. So they have a lot of experience using Laerdal I don't know what they're called actually, but the Laerdal mannequins that are used for training first responders, CPR, that type of thing. And what you can see here is an integration in a Unity application with a Laerdal mannequin. What's interesting, and if anyone in the audience is curious, we can give them more information about this later, is that Loma Linda found this scenario to be so successful that they actually broadened it out, and they did a much larger training that involved, I think, about a dozen mannequins in different states of injury, and they put their residents through a triage training scenario, where they had to basically prioritize how urgent or how much emergency treatment each crash victim would get. They did a bus crash scenario. So they've seen a lot of value from this, and I really love how they're pushing the technology. They set the whole thing up in a green room, so they have full control of the visual imagery. I love it for me because they used all of our features. Like with Varjo, you can do things like you can select like a certain color or tone, and have the synthetic world push through that tone, just like, you know, green screen in a meteorology room, or you might have one there with you already, Stuart. But
so
they could basically, yeah.
Yeah, I'm going to go through this video here. I looked at it earlier and I really had to do a double take. Is this like a human that's kind of staged to look like they've got an amputation, or is this a mannequin?
It's a mannequin.
Mannequin, oh my goodness. And so the overlay that we're seeing there with the blood squirting out, etc., that's purely augmented reality. That's purely the Varjo adding that rendered images on top of that, right?
I believe so, yeah. And you can use several different ways of tracking in order to register basically that synthetic content over a real object.
Well, I definitely think that MITIE XR, you know, our Center for Extended Reality, could host a workshop like this in the near future, because this is just mind-blowing, to be honest. Now, the next slide, I know we're dealing with Luxonic and their Sievert technology, and we actually have a full video of that with some audio, so I'm going to play this and maybe we can discuss it afterwards.
Absolutely.
Introducing Sievert, a modular radiology workflow platform for virtual reality that's transforming the way radiologists learn, interact, and work. For the first time, radiologists will have their entire workflow, from medical education to collaboration to diagnostic radiology, in a single integrated and portable system. When a user puts on a Sievert-enabled VR headset, they're transported into their own personalized radiology reading room. From this hub, they can access multiple radiology workflow modules and switch between them seamlessly. Let's have a look at what's available in Sievert today. At its core, Sievert is an advanced visualization system for medical DICOM images. In the basic Sievert module, a user can upload medical images from their local hard drive onto 3 giant viewing screens. They can then view, interact, and manipulate those medical images with access to all of the tools that they would normally have in a traditional reading room. They can even extend the usefulness of those tools with our additional workflow modules. Much of radiology education happens in person at the hospital, in the reading room, over the shoulder of the radiologist. This has been especially challenging during COVID, when hospital access has been disrupted and students and residents can't afford their own reading rooms at home. Through partnerships with education providers like Radiopedia, our medical education module provides students, interns, and residents with 50,000 self-directed radiology teaching cases, making it one of the largest repositories in the world. But what happens if a resident wants to learn collaboratively with their radiologist mentor, or a radiologist wants to consult with a colleague, or even attend a continuing medical education session? With our collaboration module, radiologists can now securely share a virtual radiology reading room from anywhere in the world. Up to 5 users can speak with each other while viewing and manipulating image data in the same way they would in the physical world. Whether it's for education, consulting with colleagues on a case, or even communicating with patients in the future, Sievert is a game changer for collaboration in radiology. Sievert modules can work independently or in tandem with each other for added value. We've already started selling these 3 modules and have a healthy sales pipeline in North America. Over the next 6 months, we will be launching 3 more modules, which will complete the core feature set of the platform. For many physicians, interventional radiologists, and surgeons, 3D or even 4D medical imaging data is an integral part of patient care. However, interacting with 3D data on a 2D screen is cumbersome at best. With our upcoming 3D visualization module, we are giving our users the ability to reach out and grab their patient data, interacting with it like never before. Combined with our collaboration module, radiologists and their colleagues will be able to teach medical students about anatomy, or monitor the effectiveness of an image-guided therapy, or even prepare for a surgery as part of a care team. Seamlessly integrating machine learning into radiology workflow is a key part of improving the efficiency of radiology services. In partnership with NVIDIA, we're bringing ML workflows into VR for both research and clinical use. The future workhorse of CVERT, our diagnostic module, has already been authorized by Health Canada for sale as a Class II medical device for radiology. Before it officially launches in 2022, we're working to seamlessly integrate with software from several market-leading radiology workflow companies. With the diagnostic module, radiologists will be able to access the PACS, RIS, dictation, and reporting software, all within our portable, low-cost virtual reality platform. For the first time...
Now, we just move on. I think what I really do love about this platform here, right, is, they mentioned that they're a Class 2, well, hopefully this year they'll be for sale as a Class 2 medical device. So they obviously have some level of FDA approval, and you can use this in a regulatory compliance manner. And it's in accordance with HIPAA, etc. So this is really bringing technology into healthcare, into the surgeon's hands, and he can start using this. Because that's the other thing. It's quite hard, right, to see how surgeons and healthcare people actually utilize this new technology, and sometimes there really is a bit of a barrier there. So what are your thoughts on Luxonic and CVERT and this method of VR radiology?
Yeah, thanks for asking. I just went to my first RSNA with Luxonic, I guess a couple months ago, and I was pretty blown away with the feedback on it. We got to show this to dozens of radiologists, and the thing that struck me, being new to the space, is that the need for efficiency is there. Like how many images a radiologist goes through in a day or in an hour is pretty astounding. So where my thoughts are is like, where can Varjo really help, or where can VR technology help, is that if we can help a radiologist get through more images quickly and accurately, then we have like a really good case. And the consensus at RSNA seemed to be that it can do. I also really like the idea of teaching, of being able to bring in experts. I know one thing Luxonic has talked to me about, and some of our other partners in Canada, is the need for bringing expertise into the far north regions. So where there might not be access to specialists, being able to give patients access to specialists when they're in remote areas, and give those specialists access to those patients. One thing I'd want to call out too is that the resolution of other headsets is good enough to do this without Varjo, but one thing that was told to me was that for mammography, our headset is the only one that's high enough resolution to do so. So I'm really interested in seeing what happens, as this year unfolds and we get these into more use. I should do a plug. We're doing a webinar in March with Luxonic and with some of our early end users at a high-profile clinic in the U.S. that I am not allowed to name yet. But please stay tuned, and if you want to check up on Varjo News, we'll be talking about that more in February. That's great.
And moving on, there is another company I know that are kind of active in this space, and that is Realize Medical with their Ulysses system. Now, we have a really nice video as well that we can show on that system, and there is some audio here. So let's turn it up.
Introducing Ulysses, the fastest and easiest way to create accurate and detailed 3D anatomical models directly from medical images. There is a growing demand for custom 3D anatomical models of patients for treatment planning and clinical education. But traditional solutions are time-consuming, difficult to use, and tedious. Users who want to view images and create precise patient models are inhibited by 2D workspaces. Ulysses solves this problem by enabling users to create 3D anatomical models in virtual reality. With Ulysses, use handheld, innovative virtual reality tools to draw directly on medical images and bring a full, user-generated 3D model into existence in front of your eyes. Explore your immersive simulations of patient anatomy within the platform, or export your content for 3D printing or mixed reality applications with a single click. Elucis makes medical modeling easy. Are you ready to feel the power of Elucis in your own hands? Visit realizemed.com to download a free demo today.
So Jeff, can you comment on Realize Medical System?
Yeah, I should say I really love this application. I just got done doing some of the how-to videos for the Varjo team, and I'm a very visual person. You know, I used to work in camera departments, and it's really beautiful imagery that's created, and I love how tangible it is. But obviously, that's not really what it's for. Is to be beautiful. The thing that I think is really cool about it that I'd like to talk about a little bit is that, for one, they've worked out a workflow where the models that you create virtually can go straight to 3D printing. So you can work in this virtual environment, tune your model, and hopefully not have to do many different prints or anything like that. And then the other thing, and I mean, this is maybe a little bit of a leap, but we've been talking to different researchers at different med schools together, Stuart, and we saw some really interesting data last week coming out of an East Coast school that was showing how much more effective virtual reality was as a modeling tool when it comes to cardiovascular. So it wasn't dealing with Elucis directly, but it was the exact same concepts. And what this person had demonstrated is that when designing some kind of a shunt or a product that was to go into someone's body to create an intervention, that the people doing it were able to make different choices that were better, that led to better outcomes, and they were able to do it more quickly when they had that tangible virtual feed that involves being able to look at something stereoscopically. So your brain is taking full advantage of the depth perception of being able to look at it in your right and left eye, and you're able to really handle it at scale without having to deal with different viewports or other things. You can move quickly, you can move intuitively, and hopefully it leads to a better finished product of either a procedure or something that's going to go in someone's body.
And that's a great point there, Jeff. I think with the Varjo, given it's such a high-end, high-resolution system, when you start incorporating things like mathematical modeling and adding physics to real-world or VR objects, you can then, you need the Varjo system to allow that high fidelity to be visualized, right? So like you're saying, you've got a patient image there, you're inside the patient, you're looking around, and you want to bring in your shunt, or you want to bend something, you can incorporate that mathematics and the physics in there, and it will tell you if it can work or not. And we actually had a question there talking about what they were asking more about your system for 3D printing. Now just so we're clear, the Varjo system itself, right, doesn't allow for 3D printing, but what it does is it operates with third-party software like 3D Life Prints, for example. There we go. Like 3D Life Prints, for example, are a company that allow you to import DICOM images and segment out a region of interest, and say hello there. And you can then upload that image into the Varjo environment where, like you were saying, you can move it around, change it, and then export that as a .obj or a .stl file for your 3D printer, right?
Yeah, I mean, this is a space that's actually fairly well trod outside of medicine, because what we deal with all the time with our automotive customers is interchange formats between, basically dealing with either parametric CAD 3D or scanned. So the world is really developing really quickly, and the ease of use of going between formats is getting really smooth. And companies like Unity, Autodesk, Dassault, and the 3D printing companies are really starting to work much more hand in glove. So the same sort of decimated the word's escaping me, but basically the visualization models that we use, that we pull up, are actually a series of triangles with textures pasted on them, and the files that are printed are slice files that can go into a printer. And the amount of efficiency and speed and the kind of the native turnkey interchange that's going on right now makes it really easy to, fluidly change between visualization to printing to, what's actually going on. So you can do something like move from a point cloud to a visualization format to a print format fairly quickly, all with, using software product as intended. And, Varjo is just a small part of that. But I'd like to think that we're helping push it forward and helping people use this new technology and be able to visualize it much more, accurately.
So moving on to our final medical application, this is a Touch-Life Technologies, okay? And I'm really glad we're showing this because we've been trying this out at MITIE XR at our Center for Extended Reality. And we have MEng students here, so this is a program between Houston Methodist and Texas A&M where they're training to be an MD, but also an engineer at the same time. And they have their anatomy classes here at MITIE. So we've been working with their tutor, Dr. Leslie Day, to integrate Touch-Life Tech and the VH Dissector into their curriculum. Because there's just so much that you can get from an XR-based system that you really can't get from a cadaver approach. So, Jeff, you want to talk us through what we're seeing here?
Yeah, absolutely. And I mean, I love Touch-Life Technologies. This company has just been so wonderful to work with. But what we're looking at is a technology that was developed, I think, almost 10 years ago by Vic Spitzer. And what it is it's a way of actually slicing a cadaver to get extremely precise data. And what they've gone through after the slice data has been built, it's actually manually processed and rotoscoped and annotated the full human body. So each system has been painstakingly cross-referenced and isolated. And now what we have is a full, male human data set that separates itself from other anatomy trainers by being real human data. So what you're looking at is not 3D model, it's not created by an artist. It's the actual tones, colors, shapes, and sizes of the real human body. So I think it's a super powerful tool for teaching.
And I mean, just a point there, it can be quite scary actually a little bit when you're in a room on this and you're just staring literally face to face with, somebody. Because it is that realistic. You put this Varjo system on, you are there, you're seeing this. So I think, we're going to try something really interesting here, Jeff, right? We're going to actually get a demo set up. So while you're setting that up, we're actually going to see Touch-Life Tech in action here. Jeff's very kindly agreed to put on his Varjo XR3 headset and get this fired up. So while he's preparing that, I'm just going to go through a couple of questions that are coming in. There was a really interesting one there about sitting close to the TV. So obviously your parents have been telling you since you were born not to sit too close to the TV, and now the TV is 1 inch away from your eyeball. How safe is this? Well, just remember, think about the physics of how TVs actually work. Now, John Logie Baird was the first person to invent television back in the early 1920s. He was actually Scottish. And a lot of those old TVs, well, the mechanical ones, they went on to be utilizing cathode ray tubes. So they're firing electron guns at a big phosphorus layer. So if you're sitting in front of that, goodness knows what you're getting bombarded with. So secondary radiation, electrons, etc. How it is now, I'm going to let Jeff take that question later on. Can you comment on development of haptic feedback? That is a very big one. Obviously, haptic feedback in this case is, you're in the VR world and you're doing things, but it doesn't feel like you're doing it, okay? You've got that sensation of touch. With a lot of the controllers, they can vibrate, they can do things, so you can actually feel a little bit more like you're doing something. There are haptic controllers out there where if you're doing the total knee replacement there, for example, you actually feel like you're pushing in. And the MITIE XR is actually getting a system like that. We're working with Fundamental VR Surgery from the UK, and they're giving us their orthopedic simulation suite and a bunch of other simulators, but they have the haptic controllers. Someone's asking, is the system for demo for sale? Nope, it's not a demo, it's for sale right now. You can go out and buy one right now. Go to varjo.com. Jeff, it looks like you've got things working there.
Can you hear me?
Yes, we can hear and see.
I'm
Perfect.
in the metaverse.
You're in the metaverse.
Here at this.
Say hi to Mark Zuckerberg for me.
So yeah, and I will do. I will reveal the cardiovascular system. So I guess if I'm narrating this, one thing I would point out is that because everything exists as a discrete object, what I can do is basically, if you can see what I see, all of these systems are grouped. So I can go in and basically treat anything as a region, as a system, or as its own group, and highlight it or make it invisible or make it visible. So I'm going to hide all the systems, but then I heard, Stuart, that you are interested in the cardiovascular system.
Correct.
And so what I can do, and there's this fat and skin layer that you can fade in and out. What I can do here then is then isolate this entire system and look at all the parts of it, how they interact. And then one thing that was, pointed out as well to me actually just yesterday is that, you're able, especially given the depth sensing that happens and the hand tracking that happens with our system, is that you can actually, in a realistic way, gauge the sense of depth and scale of the human body. So you can see how big something might actually look, in the space, not just the size and shape of it.
So Jeff, can you maybe get a little bit closer to the heart just so we can see that resolution? Put your head right in there. There we go, look at that. That's incredible.
How's that?
Incredible, yeah.
So
now, and you can see how the complexity is just going to grow. I mean, once you start putting mathematical models in here, you can start having flow. Start seeing flow and pulsatile flow. I mean, I think there's a lot of limitless applications here, right?
Absolutely. Yeah, and because all of these objects exist as digital assets, they can basically be revised and refined infinitely. And it can also be ported out and used for other purposes.
So Jeff, that's brilliant. We're going into the last 50 minutes of the show here, so I think it'd be nice to finish with some Q&A. Somebody's asking, can you create an image and bring it into a video software for animation or modeling? I believe you can. You just need to get the right software in there. You need the software that you go in and you can start creating 3D objects. You start shaping them, and then it'll just be a button in there you press and it just exports it as a file, which you can then integrate into programs like Adobe Premiere Pro or any other secondary processing software. Someone's saying Methodist is a Siemens Centre of Excellence. That's right, we're one of the biggest installs in the country, if not the world, I think. Are you working with any of the big imaging companies? We could be. We are. Again, there's stuff we can't say, but I know that a lot of these big imaging companies are interested in the activities here at MITIE XR. We're just building up that portfolio of research and development. Going back to the crash scenario, what input do you need to create the visuals? So I'm going to put that over to you, Jeff.
Yeah, so there's actually a really interesting web presentation that Dustin Smith at Loma Linda put together with me on this that goes into pretty great detail about how they did it. But essentially, to simplify it, they built a video game in Unity that was this bus crash scenario, and then they used some hooks into the layered all user interface that controls the mannequins, to create the interchange there of data between their video game application and the real world mannequins.
Got it. So a couple more questions here. So I know you can't say much about what's in the development pipeline, but it's like, where are you guys heading into? Is it reducing the form factor maybe of the headset? Obviously we want to get to untethered headset. So what's the bottleneck, for example, with the tethered headset? Will 5G technology help get around that, for example?
Yeah, I mean, Varjo sees 5G as further out, I think, than some other companies and people do, so we haven't really based anything completely around that. The problem that we have with it is that for a company that's based around visual acuity and super high performance, there's not really any kind of wireless technology right now that will do it. So it's something that we're focused on. It's something that we're looking at, and we're looking at alternative solutions from just a standalone headset like a Quest. But it's something that we're looking towards. To that end, one thing that we're starting to roll out very slowly this year is something called Varjo Reality Cloud that also works with Teleport. And what that will be is a system that allows you to stream high quality virtual reality and mixed reality content from a very lightweight system. So we'll use some cloud architecture to basically allow something like Touch of Life Technologies to be deployed on one instance on the cloud, and then to be activated one instance on the cloud and then deployed via a laptop. And there will still be a tether, but the compute requirements will be significantly reduced. And we see this as a step in the direction of, doing what all technology will ultimately need to do, which is become easy and invisible, which we're definitely not there yet, but we'll take a step in that direction in the next few months.
Got it. And just to go back to the question, someone asked earlier about the safety of these things. You're in there, you've got these TV screens right next to your eyeball. Have there been any studies on the health impacts of this? Any ocular degeneration, that type of thing?
I don't know of any that's actually focused on light and brightness. I know that our first customers in the flight sim space are very careful about simulator sickness. We found that having a proper IPD adjustment does a lot to ameliorate that. So I don't know if it causes actual health effects, but one thing that we saw that causes a lot of discomfort is basically headsets being adjusted improperly. So what you can see here then is these two lenses not being the same distance as your eyes are apart. So that can cause a really uncomfortable condition, can cause headaches and stuff. Our headset uses our eye tracker was developed basically to mitigate that problem. The other thing that we're always talking about it with headset companies is something called eye relief, which is basically how far away can we get the lenses from someone's eye while still making a headset that's comfortable to wear, so like the weight isn't distributed too far out, and has a high enough field of view. So obviously, if you're looking through lenses that are this far away, the field of view is diminished, but if they're very, very close, it's wide. So what we try to do is strike a good compromise of something that has, a lot of eye relief that's correctly adjusted. But as far as the light effects of having like a screen, I haven't seen any studies with that. I know that the infrared light that is used by eye trackers has been studied very closely and found to not cause any adverse health effects.
Got it. Now, I think as MITIE XR develops, we're going to pay particular attention to that. So, again, go to robotichealth.org and we're going to start uploading videos and research and documentation relating to that. I think the final question tonight is, what makes your headset different from others on the consumer market?
Yeah, as I stated earlier, the main thing that separates our headset is visual performance. Well, there are a few things. So it's visual performance, which means we have 2 displays per eye instead of 1, which allows us to deliver about 3 times the real visual acuity in the user's field of view. So we deliver human eye resolution. Like we have companies that are actually building eye tests with our headset, because our headset is high enough resolution to actually start prescribing corrective lenses based on the acuity. I think that's a really nice vote of confidence for that. And then having video as our mixed reality medium, that also separates us and allows us to, again, deliver more visually rich content. And then finally, I would say the eye tracker. Some other headsets have eye trackers, although it's more rare, but ours is by far and away the best, and again, hits those kind of performance standards of resolution and refresh rate that the others do not.
Okay, well, I think on that note, as there's no more questions, I think we'll close it out. for the evening. So I'd just like to say thank you again, Jeff, for appearing on the show. It's been great to have you. I'm looking forward to working with you guys a lot more as MITIE XR progresses. Secondly, to the audience, again, robotichealth.org. That would take you to our new Robotic Health YouTube channel. So please go there and subscribe, and you'll get access to all the new things that we're uploading. And finally, anyone here at Houston Methodist, especially that's interested in trying out this technology, we have a lot of this equipment here at MITIE. MITIE is our Methodist Institute for Tech, Innovation and Education. So just drop me a line, send me an email, and we can get demos set up anytime that you'd like. And on that note, I'd like to thank you again, Jeff, and good night, everyone. Goodbye.
Thank you.